She looked at me and she said, Michelle, I can leave the house. I can walk around the block. I can leave my baby. I can feel confidence. I've never thought that I would ever feel that this could be my experience, that this could be postpartum for me.
Welcome to the Lifestyle MD podcast, a podcast dedicated to high-achieving women who are conquering their careers while striving for total wellness. I am Dr. Angela Andrews, and I am thrilled to be your guide on this journey. I am so excited to have you here with me today, Michelle. So I have Michelle Haggerty. She's a physician boarded in family medicine, integrative medicine, and breastfeeding and lactation medicine. She is the founder and CEO of Fourth-trimester Doc, a private practice providing in-home medical care to birthers and their newborns postpartum. She provides postpartum and lactation coaching nationwide. She's the co-founder and co-executive director of the Center for Fourth-Trimester Care, a national nonprofit providing education, business support, advocacy, and community for professionals working in the fourth trimester space. She is a mother of 2 angel babies and 3 sons earthside. Wow. First of all, I didn't know that such a thing existed, and I am thrilled to just hear what all of the wonderful passion that you have and what you have to share with other women. And I'm looking forward to learning from you today. So thank you for joining me, Michelle.
Thank you so much for having me. I'm so excited to be here. It's just been in the making.
Yes, yeah. That's right. All good things come in due time. Just give us a little bit more background in your own words. Just how did you get to this point in your career, this business, and this nonprofit?
Yeah, absolutely. So as you said in my bio there, I started off as a family physician, worked in a standard clinic setting for several years, and then had my own babies and realized, wow, we do not care for families really well in this postpartum time, fourth trimester, and really just felt like, oh my gosh, like what are we doing to folks, and what are the things that I wanted? I wanted somebody to come into my home. I didn't want to have to go into the clinic. I mean, I was still in diapers myself, that 2-week time frame, and I couldn't fathom even putting pants on and trying to carry the car seat into the clinic and having somebody come and take care or see my baby in the clinic and make sure the weight was good and the bilirubin and all the things. I kept thinking, why is somebody not coming out to my house and doing this? And yeah, so then I tried to, in the clinic setting, in the standard clinic setting, try to start doing home visits for families, and found out I was just really doing it on my own time. I wasn't really getting the administrative support to do so, and got to a point where I just was like, okay, I just got to do this on my own. So I started my own private practice, and sort of the rest is history. It's been filling and really, really hard and all the things, but I've been using a whole part of my brain that I never really thought about that I would ever get into, right? The business, as physicians, we're really resilient, obviously, and we're incredibly smart, and we can figure these things out. And so I just every day was like, I just need to figure out one new thing every single day to sort of move forward in creating this practice, because it was something that wasn't done before. It was sort of like, well, I'm just going to take a leap of faith and see what happens and see if we can make this sort.
I mean, as you were talking, my first thought, and you answered it, was were you able to even do that in your traditional practice? So clearly no. And when you decided to take this leap, were there any examples or anything that you could parallel when you were looking to start this?
The beauty of it is when I went and did my integrative medicine fellowship with Andrew Weil in Arizona, part of the training was, and this is what we don't get in medical school, but part of the training is like all the different business models that can happen in sort of the medical world. So direct primary care, concierge, the coaching, the fee for service, but cash based, right? And so all of these different ways of, being able to provide medical support or wellness support to folks that's not in the traditional standard medical sense. And what's interesting to me is that in medical school, essentially for me, it was like, you're sort of told, nope, you're going to work in a clinic or you're going to work in a hospital system. You're going to work for somebody else. You're always going to be an employee. You're never going to be an employer. You can't work out on your own. It doesn't work. You won't be able to afford your malpractice, like all the things. It was just all these.
We're not going to tell you how to do a business because, of course, why would you do that?
Right, exactly. And you're going to always work for somebody else, some MBA somewhere, right?
Because they know better than you.
Because they know better than us, right? Exactly. And then you're never going to be able to make work otherwise. So you're only good at the medical stuff. You're only good at the medicine piece of it. You're not going to be able to do this other side. So for me, that just opened my eye. I was like, this huge shift happened when I realized, oh my gosh, wait a second. Number one, there are ways of doing this otherwise. Number two, there's all these people that are successfully doing it, and there's all these different models. And then what was really cool is it wasn't just something that was repeated over over and over again. It was all these different unique models that then I was like, well, wait a second, I could just dream up whatever practice I want, make it to come to fruition. And then I just need to do some of the background stuff to make sure that it's, legal and, whatever, all the things. So to me, it allowed me to dream, open things up. And so then when I was at a yoga retreat, doing some perinatal yoga training, and I was in Shavasana, so like in sort of meditation at the end, and I was actually pregnant at the time. I had this just vision of this practice of exactly what I wanted, going into homes, seeing families for long visits, and really getting to know them and them getting to know me, and just having a really great relationship, and being able to like text message and call, and there wouldn't be this like very strict like hierarchical kind of patriarchal sort of system, and just having that honor of just being able to cross that threshold into their home and being invited and being in that sort of very 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 unique and vulnerable space, and I remember just a couple tears just coming down my cheek as I was laying there, and just thought, oh, this is it. This is it.
So that was probably a huge turning point for you in your career, and I'm sure in just so many ways. So tell me what that transformation was like for you as a professional, as a mom, as a woman. What did that mean to you?
Well, what was interesting is I had that vision, but it didn't come to fruition for a couple of years after that. Then again, I was like, can I make this happen? Is this possible? And how do I do all the things to make it? And then I was just busy with work, kids, and things like that. But then I had somebody who came to me and said, will you be my baby's pediatrician? I'm pregnant. And this was a close colleague of mine. I adored her, a partner, and I really wanted to care for her and her baby. And I knew though that if she had come to see me in the clinic, it wouldn't be what I would envisioned the care that I wanted her to have. And I remember just taking a step back and saying, and looking at her and saying, I can't. I don't like who I am in the clinic. I don't like who I am there. I don't like I don't want you to see me in that light. I don't want this to taint our relationship. I didn't want any of this to happen. So I wanted her to have the best care possible for her and her baby. This isn't possible in that setting. But then I said, oh, but I have this vision and I have this dream. And would you be my first patient? And she, no hesitation, absolutely yes. And so they paid me. And so then I was able to do the LLC, do all the things like that. And so I had 6 months to kind of figure it out because she wasn't due for a while. Sure. And it was perfect because it was like almost like this proof of concept, right? It was somebody that said, yes, I believe in you. Yes, I believe in this vision. And yes, I want this for myself. And yes, let's make it happen. It was that shift. It was coming from a place of just sort of doing the work as a physician and feeling like I needed to sort of be a cog in the wheel and just, pushing through and seeing all the patients and not really feeling like I was helping with healing or really making a difference in people's lives, to then shifting to a place where I could meet people where they're at. I was able to provide the care that I loved and I knew that I wanted and I was good at, provide it in the space that the people wanted it and where they needed it as well, right? So it ended up being this perfect storm of this is where it all lands. And so for me, that was the shift. It was the shift from just doing what I needed to do to get through the day and feeling so drained at the end of the day to then moving into a space of energy and love and light and passion and excitement for the work I was doing. So it was a huge shift. And then that changed as a mom. I went from being drained and burnt out and tired and exhausted to feeling excited to come, I was coming home at the end of the day after seeing families. So it just helped me overall be this a better human, really,
Yes, a better human being. Imagine that.
Yeah, right. Exactly. I don't know if you've heard of this term before. There's a term called ikigai.
No.
So a term called ikigai, and it's a Japanese term, and it means sort of the interconnection where your passion overlaps with what you can get paid for, overlaps with what you're good at, overlaps with where everything comes together, and you're just working from exactly where you're meant to be. So that's what I felt like I had shifted into was my ikigai.
So it's really interesting to hear you describe that, because I feel like I intuitively have heard that, I'm aware of it, but it's certainly not something that we tend to do as clinicians, right? That's not what might have been what we envisioned when we went into medicine, but it's certainly not how it all plays out. And that's the space that I'm in right now. I didn't know there was a term for it. Yes, this is hard, doing the things of being a coach and running my own direct primary care practice and doing these things and sharing my knowledge and passion with the world and putting things back out into the world and having time for my family. I mean, just all of these things are coming together. It's hard to put into words that space that I'm in. Where has this been my whole life?
Exactly. It's where your passion, your missions, what the world needs, what you're good at, and what you can get paid for all combined.
I really feel like that's something that we should all strive for. I mean, I think the world would be a better place.
Yeah, exactly. Yes. Right? Yes, it really would be.
Yes, I agree. So I want to take a step back. What took you down this road of integrative medicine? And it sounds like it was a really instrumental tool to getting you to where you are today.
Yeah, so integrative medicine, I think interest in that space. I'm an osteopathic physician, so we have some training in sort of integrative modalities, just being exposed opposed to manual medicine, for example. And nutrition, I've got a background in nutrition. My undergraduate and graduate degree programs are nutrition and master's in public health nutrition trained. There's already been this sort of the background with me of medicine isn't the way that we necessarily heal, right? Okay, so I've always had sort of an interest in ways of healing, right? So that medicine isn't the only way of, and really isn't the way of healing the body. It's just sort of a band-aid for most things. And so, I wanted to dive in more and deeper into trying to figure this out and how do I better support my patients? Again, I was sort of working from a space of feeling like I was just sort of cog in the wheel, pushing patients through it. I thought that there's got to be a better way of supporting families. And so, in medical school and residency, I'd done rotations in Arizona with Andrew Weil doing integrative medicine stuff. So I started that early on. I knew that I wanted to do fellowship at some point. And then this was a way to help me expand my horizons, really. Integrative medicine in itself is just a way of looking at the whole person, really, and also all the different modalities of ways of supporting the body in healing itself and in keeping wellness, right? So the way that the training sort of includes things like nutrition, it includes herbs and supplements, lifestyle medicine stuff. So, sleep and exercise and not partake, like smoking and things like that, trying to cut back on maybe habits that are not so helpful for the body. Also looks at other modalities as well. So like acupuncture, Chinese medicine, and Ayurveda, massage, and manual medicine, and all these different ways of healing that allow the body to really work optimally. So what integrative medicine does then is we're able to sort of look at the whole person and figure out, okay, so what are the things that we can do to support and what are all the different tools that we can use to support people in their wellness? I use it a lot in my practice because I specifically with perinatal mental health is a big one because so many people are just given Zoloft or Lexapro or whatever and just sent on their way and said, okay, you're just going to take this, and then also not even given a time frame. Like, how am I taking this forever? What's it's looking like, right?
Yes, forever. I don't know. I was just given this. I don't know how long I'm supposed to do this for. Yeah,
exactly. They just handed me this prescription and said, best of luck, basically. And that's not what I do. There's lots of appointments, lots of visits, lots of follow-ups, making sure that people are really, and we're working through things like, okay, so you're giving people medication for something. Are they nourished enough to be able to actually build and create serotonin? Are they so inflamed and they have so much inflammation in their body that then how are they able to even move toward wellness that way? So we're talking about using things like turmeric and exercise and meditation and mind-body medicine and things like that to help with bringing down the inflammation in the body overall, which is it can be very inflamed postpartum because there's lack of sleep, very undernourished, we're depleted of nutrients, right? And so we want to try and really support all of that.
As you're talking, I'm feeling really emotional because it makes me sad that this isn't care that all women get, right? That this isn't a part of our culture. This isn't the standard of care in medicine. Wow, I get it. And I'm sure more people that hear this and understand this, they'll also get it. You were talking about postpartum depression and all the mental health. I want to kind of take a deep dive there because this is a huge part of what you do and it's a huge part of what a lot of women struggle with. So let's kind of back up a little bit. When you're approaching a family, first of all, what does that look like? And then how do you support a woman, especially when it comes to that mental health piece from beginning to end?
Yeah, so there's several different sort of avenues. A lot of times I'm seeing people from even before they give birth. So we do postpartum planning to plan for postpartum to try and help really sort of stack the cards in their favor, right? Give them all the tools that then will support them so that maybe they won't even get to that space, right? Maybe they won't even.
Yes, we want to be pregnant again, just so I can work with you.
I love that. Thank you. But that's what I want people to be excited about, right? Because that so many of my patients, that's exactly what happens. I've had several patients most recently that were terrified of getting pregnant again because of their postpartum experience last time was so horrible that they could not even imagine expanding their family because of that postpartum time, right? Which is, to me, that's incredibly sad because there's so many things we can do to support them so that they don't have to go through, it doesn't have to be this horrible time for them.
That doesn't have to be the norm.
It doesn't have to be the norm at all. So many people are sort of navigating that, right? So we want to prevent it from the first place. We want to try and give people as much support and as much guidance and as much just lifting them up to be able to not even get there. And of course, it still happens. And of course, there's hormones and all these things that are still at play. So of course, we're still playing with trauma in birth, which is a huge issue as well. But what we're doing is we're processing those things early, where they're getting support early. It doesn't become a crisis then. It doesn't get to that point of crisis because we're able to do a lot of things in between to try and get support.
So you're being very proactive which is
extremely proactive, which
very
is
much the
preventative medicine, which is what we should be doing in medicine in general, right? Which it shouldn't be so reactive. And then there's the folks that do get to that point, right? And they're seeking me out for consultation for perinatal mental health in the postpartum time, because now they're at that point and they didn't see me before. And then that's sort of another way of, that we hold people and hold that space and try and support them. So, I mean, it's everything from getting them in with a therapist, of course, and I've got a lot of connections with the various therapists, and at least locally in our area, and then working with, again, repletion, working with the acupuncture or massage or other sort of body support systems, using herbs and supplements to help navigate some of it, and then of course medication as well. So I'm not anti-medication in any way, shape, or form. I love Zoloft. I love Lexapro. I think they're beautiful medications.
Yes.
But there is this sort of, there's so many other tools. There's 100 things in my toolbox that we can go with. And what's going to help the patient the most is what resonates with them. If they're not bought into what the treatment is, they're not going to feel like it's helping. So, I can't, if I am just telling them they need to take medication for whatever reason, and then they're not actually taking it, or they don't feel like it's going to be helpful, then it's not going to be.
Right.
And one of the interesting things I've learned most recently about SSRIs, and I'm not sure if you're aware of this, but so we think of SSRIs, selective serotonin reuptake inhibitors. And so we think that it's the serotonin level that is, that we're trying to keep high so that it helps with their mood, right? But there's actually some evidence that shows that it doesn't matter what the serotonin levels can be various at various levels, and that doesn't really make a difference. And so it's not that. They actually think that it potentially is that the SSRIs are anti-inflammatory, and that's what's helping.
I totally buy that. Similar vein, Wegovy and Mounjaro and all the GLP-1s. There is study after study and case report after case report that's looking at the anti-inflammatory characteristics of these medications. So in my practice, I have diabetics to weight loss, and among my patients, I have seen a dramatic improvement in inflammatory conditions, so the autoimmune problems, rheumatoid arthritis, the lupus patients, and I've also seen an improvement in the mood disorders. So, and it's since the initiation of these medications, and it's not because they're necessarily losing weight or their sugar's better controlled. It's the anti-inflammatory piece of it. So, oh my gosh, I had not heard that, but I totally believe it.
Well, so then you think about, so if we're using this as an anti-inflammatory, then what are all the other things that we can do? That we can then help with inflammation, right? Is it really necessary for the medication itself, or is it that there's a lot of other things that sort of standard medicine and the standard medical system doesn't have or hasn't used in
and how can you enhance that?
Right, exactly. And honestly, it takes time, and that's part of it, is that in the system itself, you have 10-minute visits, and you have to sort of come through people, and so you can't get into what are they eating throughout the day, and what is their stress levels, and what does sleep look like, and all these things, when really you don't have that time and space and really energy to be able to really dive into that system. So it needs a different model.
And I can imagine that what you do is not covered by insurance, right?
Yeah, well, so it's I'm working. It classically doesn't. What I do is provide a super bill for people, and then they get reimbursed from their out-of-network benefits. And actually, a lot of people get a decent amount covered with that way, which is
that's really
sort of
great.
Interesting. Because what I do is preventative medicine, so which is usually covered at 100% with insurance. So it's the well child checks, it's the postpartum care and lactation support, which is all preventative. The perinatal mental health stuff is not necessarily considered preventative, but again, be covered in various ways. But I have been in deep discussions with various commercial companies, insurance companies, trying to figure out if there's a way that they would be willing to pilot a project that looks separate than the individual fee-for-service kind of model, that is more of a package kind of value-based care that we could kind of play around with. We'll see.
Wow, you're on the leading edge of that. That's fantastic.
I'm pushing for it. And there's several of them that they're open to discussions. It's been months in the making, but years actually for some of them. We'll see. I'm optimistic it's on the horizon.
Wow, that's fantastic. I'm really happy to hear that, because one of the things I struggled with when I decided to take the leap to start my direct primary care practice was accessibility. Yes, I'm accessible from a time standpoint, but then there's the financial barrier. And even though my monthly fees are by no means extravagant, I'm not doing concierge, it's still a lot to ask for someone who's on a fixed income. I'm happy to hear that you're navigating that and advocating, because that's going to help move the needle, not just in your space, but in every space where we're looking at trying to do things that are preventive and not historically recognized in the fee-for-service world, where you can't put a label on it because it's not a problem that you're trying to treat. It's something you're trying to prevent.
Exactly. When you think about, even with direct primary care too, that you are saving people money. It's hard to see it over time, over years of care. You're preventing emergency visits, preventing urgent care visits, the wholesale pricing on labs and medications and things like that, right? So in the big picture, it does save people money, and they're paying lots of money into these premiums for their insurance, and so they feel like they want to use it.
People have been brainwashed as well to believing that's the way to go about it. So this is a little bit of like a derailment from our topic, but I have I have this Quest bill here that I need to pay from my practice.
Yep.
And there was this one, man, this really blew my mind. I had this one patient, he got some blood work done and they did not bill it at our agreed upon rate.
Right. Yes.
Right.
Yes.
And
this is where you can see.
Yes.
Yep.
Yes.
Yeah.
And I love getting these kind of bills, right?
Yep.
Because I'm like, oh, look how much we saved you.
Yep.
So his original bill was $1,300. Okay. They did a price adjustment, brought it down to $167.
Yes, right. And here's the kicker with that though, is that then what happens is people think, oh, it's covered by my insurance, so it's cheaper or whatever. But people have copays on it. So they're paying 20%, even 20% is a really good copay, right? But the 20% of that is still $200, $300, right?
Yeah.
So he would have,
and sometimes it's not kicking in until that high deductible is paid, right?
And it's not right.
Yes.
Exactly. And that's the other piece of it, right? So, and that's even after the deductible stuff, but but you have to pay all that stuff up front. And usually it's $10,000 for people's deduct. And when you're looking at the overall picture, it's saving money. And so then the same thing on my end as well is that I've saved people ER visits, urgent care visits, umpteen number of lactation visits, getting tongue tie releases for babies at dentists for $1,200 or whatever it is. And so we can do all of this so much cheaper and in a very holistic way where it's not siloed, it's not all over the place. And then they have good follow-up and they feel better. And then they're able to go back to work more and work more efficiently when their phase, unfortunately, which is way too soon in the US, and their babies are healthier. There's all these things that really, it makes a difference. So it's yes, it maybe seems like it's more expensive when it's an upfront cost and you have to start paying out of pocket. But when we're looking at the whole picture, it saves people hundreds of thousands of dollars a lot of times. I mean, I just had a patient this morning that I was talking to, and she had already spent thousands of dollars on all kinds of stuff. And it was like, oh my gosh, like, wait a second, let's back up here. I mean, I know if I'd been seeing her from the beginning, we wouldn't be in the mess we're at right now that she's started navigating. Yeah, it's challenging, but it's a different shift. It's a shift in the perception of how we care for people and really that holistic support.
To your point, it's changing our mindset and our approach, and also educating our patients, educating the community on the whole big picture, on what you're actually getting for the healthcare that you're paying for right now, versus there's more than one way to do it, and what you're getting right now may not necessarily be the best way.
Completely. Yep. And I used to work at a federally qualified health center. So that was my patient population. So it's really hard for me to leave and work in this different model where 90% of those patients couldn't pay for my, fees up front. The thing is that I'm my own boss, right? We can do a free visit here and there. Like I get to decide how this all looks. And then I've been able to work with insurance companies as well through another company that allows it actually to cut the cost in half for people for using their insurance with specifically around lactation. So there's ways of sort of being creative and making it happen to help people have access. But yeah, it's a challenge for sure. And I actually did just see recently that there's a direct primary care practice. Pediatrician is now having their Medicaid pay for the membership of their DPC patients. So this is
that's
amazing.
That's a huge move that a lot of us are trying to push for in the DPC realm, to get Medicaid to cover the fees, because we save the system so much money because we're not funneling them out to specialists and doing a lot more preventative care.
And those are the companies I've been working with is looking under the Medicaid realm to try and see if because that's where it really would save them a lot of money.
And it's a very underserved community that doesn't have a lot of access. And my heart is in the same place. And like a lot of the DPC practices, certain percentage that get services for free. And then I've got a certain percentage that I give it a sliding scale. So and then there's lots of things like the Walk with the Doc program that I just started.
Yes.
Oh my gosh, my heart. I wanted to do that since residency, and not until having my own practice and my own space. Now I get to decide what I do with my time, and I don't need anyone else's permission.
Right. Exactly. I always thought that was so funny. We're just sitting here talking. Why can't we just walk around the block together? And but no, it's too many barriers. And so now you're creating access for people in a different way, which is wonderful. So I'm just wondering, do you have a story or any stories that you can share from your experiences since you've transitioned to this private practice? There's lots of stories.
I'm sure there's lots, right?
There's everything from what I hear from people about their previous experiences. Like they were really struggling and they went into the pediatrician to have the baby's weight check, and they were really struggling with their own stuff happening. And they went into the pediatrician. They're like, I'm really, really anxious or I'm really depressed or whatever. And the pediatrician looks at them and says, this appointment's not for you. This appointment's for the baby. And they're like, okay, awesome. Like now they're just feeling very dismissed and going home. Right. But again, I don't blame the pediatrician. They don't have the time and energy and space to be able to, support it. Right.
Like 15 minutes, probably.
Right, exactly,
Yeah.
exactly. I mean, I've had just some interesting like postpartum. So I had a patient that called me at like 9 o'clock at night one night and said, Michelle, I think my side of my face is weak. What? You know, what are you talking about? Let's hop on a virtual call real quick, right? So we hopped on and yes, yep, she was having facial weakness on one side. You need to go straight to the emergency department. I will call the doc on the way over there. So she goes in, I call the ER and let them know that she's coming. And from the time that she called me to the time that she was seen in the emergency department was like less than 10 minutes. And I'm just thinking, thank goodness it was Bell's palsy. It wasn't a stroke, but it needed to be assessed immediately. And what was so beautiful about that is that if she had called regular system, it would have been a nurse phone tree, then a nurse line, then somebody would have called her back. She would have been home for this whole time, waiting, whatever, and then gone in, and then who knows how long it would have been. And this was like so quick. It was like a warm handoff, went very smoothly. Things were good. She felt very supported. She didn't feel panicked. I mean, she was a little terrified of what was going on, but she was like, I know that I'm in the right hands. I know things are going to be okay. All these things. And then I saw her obviously very quickly afterward navigate supporting her, but I reflect on like what that would have looked like in a different setting. And then there's just like the standard visits that are just so beautiful and transitioned so well. Like a couple weeks ago that had just a horrible postpartum experience the last time. Wasn't sleeping, was very panicked. And this is one that she wasn't sure that she was going to want to have another child at all. And I just saw her for her 1-month checkup. And she looked at me and she said, Michelle, I can leave the house. I can walk around the block. I can leave my baby. I can feel confidence. I've never thought that I would ever feel that this could be my experience, that this could be postpartum for me. And I want umpteen number of more kids, I mean, just amazing. The shift, to be clear, she had done a lot of work herself and a lot of work on making sure she had good support systems and making sure that she had sort of processed everything, right?
Yes,
yeah, exactly.
Yeah, it does.
And that was, so I'm not taking credit for this, but it's more about, what it could look like and what that could be for somebody. And she knew that she had the support, right? She knew that she had me in her corner, and it hasn't been any additional visits, really just very classic support that's sort of happening each week. And it feels really good to her. And she feels like she can sort of move forward easily. And we're continuously reminding her that this is a new story for her. And the previous story was a different one. And it's just a new journey.
I mean, you're changing people's beliefs, right? Because once you've had one traumatic experience, it colors how you view the world and how you view every other experience thereafter.
Exactly. I remember telling her early on too, what I need you to know is I've got you. I've got this. I don't want you to worry about things yourself, like the blood pressure or whatever is, your mental health, all these things. I don't want you to take that on, and I don't want you to be treating yourself. You need to tell me, and I'm going to be the one that's going to manage it. I'm going to be the one that's worrying about it. I'm going to be the one that's deciding what we need to do about it, right? And so then she wasn't able to like lift that burden from herself, because before she had to do it all herself, because there wasn't a system that was supporting her. So she felt like she was having to treat herself. She felt like she was having to do all the things to try to make sure that she was sort of functioning, and she wasn't, right? Because she didn't have the support she needed. Now that burden was removed from her and me then, because I can handle it, right? I'm the one that's supposed to be handling it. I'm the one that's supposed to be managing it. I'm the one that decides when we're worried about something. And then she's able to sort of just move forward with just being a mom, healing her, resting and healing her body and doing the things that she needs to do, because that is enough. She doesn't need to take on the burden of treating herself as well.
But now she can put her energy there. Do you find yourself working with a lot of women doctors, or is that part of your?
Yes.
Okay. So that seems like a natural fit, because gosh, yeah. We'll just table that for a whole nother conversation.
It's a huge one. And then,
so let's make that a follow-up topic. I really want to go there. So you have a lot on your plate. You're a mom, you're a wife, you're a doctor, you're a business owner. How do you manage all of this? How do you keep everything going, maintain your sanity? Like, how do you do it all?
I will say it's hard. It's really hard. And it's the thing that has shifted for me, though, is that because I love what I do, it doesn't feel as much of a burden. And I've had to do some sort of like self-life coaching of things as well, especially as a physician. Like, things don't need to be perfect. It's sort of this feeling of, I got to make sure everything's perfect before I do anything, but it needs to be good. It's good enough. And when I'm physician role or in my business role, I try to sort of stay in that role and not try to multitask too much. It's too hard to be a mom, be a wife, be an entrepreneur, be a physician all at the same time, and try to like navigate all of those things at the exact same time, because then I really feel like I'm sort of failing at it all, which doesn't feel good.
You're not doing good at anything. Yes.
Exactly. So when I'm home with my kids, I try to be present with them. When my husband and I, we have scheduled date nights time together. We go on trips without our children, which I think is really important as well. Just sort of reconnecting and things. And then I try and self-care. So things like meditation and going for walks and doing yoga and exercising is really important to me. So those are all things that sort of to schedule in. The beauty of the work though is that I get to decide my own schedule.
Yes.
And so I get to take time off and I get to go on field trips with my kids and I get to choose how that looks, that freedom and, you know, doctor's appointments for them and like all these things that it was so hard to do in the standard setting that now being my own boss, I get to make those decisions. And it comes at a cost, of course, like, cause then if I don't do the work, I don't get paid, right? So I need to be able to, so there's not like PTO and things that happen. It's hard when things are like, if you're having a down month or whatever, you have less patients one month or, you know, less, you know, inquiries or something. You're like, oh my gosh, everything's going to go under. It's not the steady pace that you're going to get in a clinic setting where somebody else is doing that work. So there's pluses and minuses, but I think the benefits far outweigh the stress that I had being employed, sort of needing to work on somebody else's thumb that just told me what I could and couldn't do. And if I couldn't take off of work, like I wasn't allowed to, right?
There's someone else to cover. We have to schedule all these people and whatnot.
Exactly. And then I felt guilty. Yeah.
Then you feel bad about it. Right. Well, and what I'm hearing from you is essentially you're not trying to juggle all these things at one time. You make space for each one of them when you need to. And you kind of like silo those roles. And it's important that you recognize that they're all unique roles with unique responsibilities and unique expectations. So I appreciate that you said that because first of all, that's how my brain works. And I think too often we try to juggle and multitask. And how many times do we need to be told that multitasking is not effective?
It doesn't work.
It doesn't work. Yeah, you pick a thing and focus on that. Do that. So what are top 3 pieces of advice you would give to like women physicians, women healthcare, but you know, people who are in that space and just have the world on their shoulders? What are the top 3 pieces of advice you want to give to them?
I think the main one is it's okay to dream. There's other possibilities out there and you don't need to feel stuck. And what is your passion? What drives you? What even, you know, the one patient that you see in clinic that you're like so excited to see each time, whatever that is, what do you talk about with them? Like, what is it that gives you that energy? And then explore, see what else is out there, see other possibilities and know that there is a possibility of not needing to still be the system. And it's also okay to be still in the system. It's also okay to still work in that space. But then again, when you're there, you're there. And when you're home, you're home. Like I think, you know, I never took work home with me. That was my home was my sanctuary. And that was really important for me to have that line drawn when I was in the clinic setting. Now, unfortunately, I do work from home. So it's sort of like, it's the space, but I do think it's important to sort of have that distinction. So yeah, so I love that, you know, the sort of dare to dream and just like allow yourself that possibility. And then I think the other thing is specifically around the 4th trimester and postpartum and being a mom and, you know, having a newborn and all the things. As physicians, we sort of live in this type A personality, very, you know, sort of everything needs to be perfect. And we also feel like as physicians, like we're supposed to know this, even though we were never trained in any of it. So it feels really hard to ask for help. And it feels really vulnerable to ask for help, right? And we're asking for help, unfortunately, a lot of times for people that come to us for our mentorship, or we sort of oversee. We're the ones that sign off on charts or whatever for them, or we refer to. So it can be very vulnerable to ask for help from those folks. And that, I think it being open to the vulnerability, being okay to ask for support, being okay to know that you need support. It's important to get support. And that you're not, our mom brains and our physician brains are two completely separate things, that the neuron connections that happen, like the inner circuitry that just like it short circuits all the time, right?
Yes.
So we start thinking of zebras and all the craziness when really just the baby having normal breathing patterns and it's just a little bizarre, right? And you know, we cannot doctor our own babies. We cannot doctor ourselves. We cannot be doing that because it just ends up being this huge mess.
You would not think I was a physician to see me react to things going wrong with my child when he was a baby. I mean, literally, it's like, aren't you a doctor? No, I'm his mother.
No, exactly. And that's important, right? But the problem is that I actually had to do this myself. I had to not tell people I'm a physician because I need them to treat me not as a physician. I need you to treat me like a mom that is like going through all the craziness of all this and who has intrusive thoughts that are beyond what
are beyond logic and medical reasoning. Yes, because you're a mother, and that's okay.
It's okay. It's okay. Exactly. I need that support, and don't expect that I should just know. And also don't expect that of ourselves as well, right? Don't expect that we should know, because you shouldn't. You need the support. You need the guidance. You deserve all of that. And your focus should solely be on healing yourself and keeping that baby alive. Keeping them, you know, feeding them, changing their diaper, doing the things, mothering them, doing the things that you need to do, but like you should not be doctoring them and doing all the other stuff because somebody else gets
honor
to
that space, you know? And be in that space, just like we talked about earlier. Just separate that. Exactly. Just be there. Okay.
Yeah. So those are two of the main ones. And then I think, gosh, again, this sort of comes from the postpartum space. It sort of overrides, I think, a lot of things that we do in life. People sort of equate self-care as things like eating and sleeping and, you know, taking a shower and things, especially postpartum, like, oh, you need to go, do some self-care or whatever, like you need to support or whatever. This is not self-care. This is requirements for living. This is standard stuff that you need to be doing to function in life. And so this is not a self-care thing. This is requirements. This is a requirement for life. So, and that comes from postpartum, but then also in general, right? And so we need to be exercising. We need to be, getting enough sleep. We need to be eating healthy. We need to be doing these things. And this is not an extravagant thing. This is not like something that's above and beyond. This is just what we need to do to function. And then above and beyond can be things like, getting a massage or.
Yeah, that makes sense. These are the basic criteria, the basic foundations. And
exactly.
When I talk with women, we start there. We start with the sleep. We start with the exercise, things that you just need to be doing just in general. And I also, when you were mentioning self-care earlier, and just also now, I thought about how self-care is not an event. Self-care is ongoing.
It's ongoing. It's continuous, right?
Yes.
Right.
So what is next for you and the Center for Fourth Trimester Care?
Well, first of all, I'm doing a postpartum planning workshop, a free virtual workshop for folks.
Oh, how can people find it?
So it's on my Instagram and social media. Please follow there and we can access that way. Otherwise, contact me through my website as well. I can get you the link. So free postpartum planning, July 24th at 7 p.m. So that's just sort of a start to get people sort of introduced to what this looks like and what possibilities could be. And then from there, I continue to do coaching nationally for especially women physicians postpartum. I think that's my big niche, but also any professionals as well. And then if you want to work with me, if you're local in Minnesota, then I'd be happy to support directly. I'd be honored to be a part of your world during that transition time. So,
I'm so sad that you're in Minnesota, though.
I know, right? But I will say also, there are physicians that are working nationwide as well. So if you actually reach out on our website for my nonprofit, the Center for Fourth Trimester Care, we have a directory of physicians that are also doing fourth trimester work nationally.
Genius.
So you can find people that way in your own local too.
I'm looking forward to connecting my expectant moms. I love what you're doing. And honestly, I so wish that I had you when I was in that stage.
No,
you're truly a blessing. And I'm glad that you answered the call to walk in your passion and walk in your purpose, because you're doing good work.
No, thank you so much.
Thank you.
It feels good to me. There's something sort of beautiful about being a physician in a space that is standardly very under supported, and being able to kind of meet people where they're at, that just really resonates.
Thank you so much. How do listeners reach you and find you? So you mentioned Instagram, your website.
What's your Instagram, website? Facebook, and then my website. Reach out. Happy to support that way.
Thank you so much. Looking forward to talking with you again, Michelle.
Awesome. Talk soon.
Thanks. Talk soon. Bye.
Thanks. Bye-bye.
This has been another episode of The Lifestyle MD. Special thank you to Lou Musa for the show theme music, created with Free Photography and makeup by Janae for the cover photo. And if you enjoyed this podcast and you haven't already, please subscribe today and share with another woman doctor who may benefit. You may also follow me on Instagram at Angela Lifestyle MD. I am Dr. Angela. Thank you for joining me today.